This is the Health Resources Services Administration funded Health Center Defense Lab. It is a toolkit used to assist health centers in increasing the robustness of their health information systems, assist with things like security risk assessment, attack simulation, and provides training for staff on common best practices for privacy and security. The tool that we are looking at here is the Health App Analyzer. So this is the Health App Analyzer, and its job is to assess the health app's trustworthiness against a published set of standards, including the HL7 Consumer Mobile Health Application Functional Framework Standard, as well as the HL7 FHIR standard. And so every assessment that it does is tied back to the framework that covers domains across key areas of consumer, patient, and provider-facing health apps. And so to start an app assessment, let's say that we're going to do an assessment of the Epic MyChart Health app. We put in its store link information, and important is putting in our planned purpose of use, because depending upon the focused purpose of use, say whether for clinical, lifestyle, activity level type of data, the app analyzer will use that information to then scan the app with an eye towards its intended use. And so we'll say that this is to communicate care with diabetic patients. All right, and so then we click to analyze the app, and it's going to go through the AI tooling that we've developed. It is going to go through and do an assessment of what it finds in relation to the information available about the app. It works through each of the domains related to privacy, clinical interoperability, security, ethical AI, and regulatory and accessibility domains. Under the hood, it's using an OpenAI GPT-5 class model, but it's constrained to a fixed schema, so guardrails have been put onto it. It is referencing the frameworks and standards such as HL7 Consumer Mobile Health Application Functional Framework, which is a key standard it focuses on, as well as the HL7 FHIR interoperability standard, as well as compliance and regulation standards such as HIPAA, NIST, and OWASP. All of these frameworks for privacy and security analysis and adoption are surveyed by the AI tooling and then applied according to the documentation available for a given app. And so it's running through its analysis, it's identifying key areas, it flags issues, and at the end it then provides a breakdown of a report for what that app found. Each health center who signs up as an organization. And so multiple staff can go in and run particular apps that they're looking to assess, whether they're appropriate for the patient population, and whether there's any big flags in terms of privacy, security, ethics, etc., in relation to it. So in the end, after running Epic MyChart app, it provides an overall trust score of 87 out of 100, provides a general summary of what it found in its analysis, shows you a polar chart outlining where it was sufficient in its domain scores. And then below, it breaks down each of those sections, providing a broader description of what it found in relation to privacy and data. Now, if it identifies any issues, it then provides a way for the user to look at what it was that it ran into in covering that app. And so when we're looking at the findings for clinical safety and efficacy, if we click on that, it will show us each of those areas outlining where it does well, where it doesn't, and how it could do better. And so once you've gone through, updated any of the information, then you finalize your assessment. And after doing several assessments, then you users can go to their app catalog and take a look at the different scores for each of those apps. And if someone's trying to review to find out whether, say, Calm, which is a meditative app, would be a good fit to provide for a particular cohort, then it will provide them with that breakdown. And they can again look into the specific findings for any particular area. And so again, this is leveraged off of two key HL7 standard, being the HL7 Consumer Mobile Health Application Functional Framework, which is in STU2, and the HL7 FHIR Interoperability Framework. It's hopeful that these tools can assist health centers as they're trying to navigate all the different apps that are coming out as a part of their health information systems, whether patient portals or remote patient monitoring programs. We believe that this can be a valuable assistance.